Hello, I'm Dr. William Bohannon. I work for Regional Medical Center in Anniston, Alabama. I am here to try to answer some questions about monoclonal antibody infusions, the process of obtaining an infusion or injection, and some of the basic information concerning monoclonal antibodies. First, what are monoclonal antibodies? Monoclonal antibodies are laboratory-produced proteins that mimic your body's antibodies to certain diseases or viruses. Currently, we are using Regeneron. Regeneron is a mixture of two monoclonal antibodies, casirivimab and imdevimab. Regeneron has been approved through the Emergency Use Act by the Food and Drug Administration to be used in individuals who are at high risk of progression of COVID-19 and in individuals who have been exposed to COVID-19 who are at high risk of developing problems. The Food and Drug Administration has found that use of these compounds significantly decrease the amount of progression to hospitalization from individuals with COVID-19 or exposure to COVID-19. How can I receive Regeneron treatment? Currently, we are doing the subcutaneous injection. We will require a referral from your treating provider, either physician or nurse practitioner, to be sent to our office, and then we will schedule as soon as spots are available. Folks will often ask, can I call the clinic to get an appointment for treatment with Regeneron? We cannot accept calls from the public, nor can we accept self-referrals at this time. Once we receive a request from a treating provider, centralized scheduling at RMC will contact you directly once the appointment is available. What do I need to do prior to my Regeneron treatment? Firstly, wear loose clothing. In order to optimize and treat as many patients as possible, we are currently doing subcutaneous injections. Folks also want to know, should I bring anyone with me? If you require assistance getting into and out of the treatment facility, please let the scheduler know at that time. We discourage bringing other family members, as the area of treatment will have multiple COVID-positive patients, and we want to try to limit exposure to other family members and other individuals of the community as much as possible. We do encourage folks to bring a book, something else to read, water if they want a drink, small snacks if they need, but we do discourage bringing any other family members. What happens once I reach the treatment facility? Firstly, there will be paperwork to be completed, consent forms will need to be signed, as well as a brief nursing assessment. Vital signs will be taken prior, and after the injection, there is a 1-hour monitoring period. Plan to be at the facility at least an hour, possibly a little longer, depending on how long it takes to get the assessment forms and provide the subcutaneous injections. Our office does not have the ability to follow up. If you develop significant difficulty breathing, inability to tolerate food or water, you need to contact your treating provider for further recommendations. If someone presents for treatment and has significant shortness of breath, we may refer the patient directly to the emergency room for more aggressive treatment other than the Regeneron injections. A frequently asked question is, do I have to be insured to receive Regeneron? If you have insurance, the medication is provided at no cost, but the injection will be billed to your insurance. For individuals without insurance, we are not charging them any out-of-cost or out-of-pocket charges at this time. Another frequently asked question is, can I receive Regeneron if I'm pregnant? Pregnancy is an indication for getting Regeneron, but you will need to discuss this with your obstetrician and see if this treatment is right for you. We would still need a referral from your obstetrician for the medication treatment. Another frequently asked question is, are we prioritizing patients based on severity of illness? The answer is, at this time, no. That's why we have switched to the subcutaneous injection to allow treatment of as many patients as possible in the shortest amount of time. People also wonder, does Regeneron take the place of vaccination? And the answer is no. COVID vaccination is the best prevention for COVID-19. People also wonder, when can I get a vaccination after Regeneron? Currently, the Food and Drug Administration recommends waiting at least 90 days from Regeneron treatment to receiving COVID-19 vaccinations. How long does Regeneron last? The Food and Drug Administration has found that treatment with Regeneron significantly decreases hospitalizations and progression of COVID-19 symptoms for up to 29 days.